Okay. Hello, good evening, everyone. My name is Rebecca Lafon, and I am the Director of Constituent and Support Services for New York State Assemblymember Rodneyse Bichotte Hermelyn. Welcome to our COVID-19 vaccine informational webinar. During this webinar, we will hear from health experts about information regarding the vaccine and the vaccine rollout plan. This evening's event is hosted by New York State Assembly member Rodneyse Bichotte Hermelyn and New York City Council member Farah Lewis. Assembly member Bichotte Hermelyn represents the 42nd Assembly District, which encompasses Flatbush, East Flatbush, Midwood, and Ditmas Park. Council member Farah Lewis represents the 45th Council District, which encompasses Flatbush, East Flatbush, Midwood, Marine Park, Flatlands, and Kensington. Now we will hear from Assembly member Bichotte Hermelyn.
Good evening. Thank you, Rebecca, for the introductions. I am Assemblymember Rodneyse Bichotte Hermelyn. I represent the 42nd Assembly District, which includes Flatbush, East Flatbush, Midwood, and Ditmas Park and Brooklyn. I'm also the chair of the Brooklyn Democratic Party. I want to take a moment to acknowledge those who are joining us this evening. We welcome Councilmember Farah Lewis and our panel of healthcare experts, Dr. Wayne Riley, President and CEO of SUNY Downstate Medical Center, Dr. Andrew Wallach, Ambulatory Care Chief Medical Officer at NYC Health and Hospitals, and Dr. Mary Foote, Senior Health Security Specialist at the New York City Department of Health and Mental Hygiene. Thank you for participating in this evening's webinar. Our city has been devastated by the pandemic, and disparities in our neighborhoods that have always existed were magnified by this public health crisis. Unfortunately, earlier this month, we learned of yet another profound disparity: access to the COVID-19 vaccine. The first reported demographics on the vaccine show that of the nearly 300,000 city residents who received one dose, about 48% were white, 15% were Latino, 15% were Asian, and only 11% were Black. The city and state are working to increase access to the vaccine. This evening, our experts will provide you with information on everything you need to know to decide if, when, and how you will get vaccinated against the deadly virus. Our panel of experts will discuss facts about the vaccine, its availability, public health studies, long-term impacts, and the distribution plan. I encourage you all to continue to engage with my office and our experts. If any questions remain after the seminar. Thank you again for joining us. Again, my name is Assemblymember Rodneyse Bichotte Hermelyn. Now, let us welcome Councilmember Farah Lewis.
Good evening, everyone. I would like to thank Assemblymember Rodneyse Bichotte Hermelyn for partnering with my office to organize a forum for constituents and local residents to hear the facts directly from health experts and to make an informed decision about the COVID-19 vaccine. And we know that Central Brooklyn was one of the hardest hit areas in New York City. So I want to thank our expert panelists that are here this evening to share more information and to help you make the right decisions. Dr. Mary Foote, Dr. Andrew Wallach, and Dr. Wayne Riley. We appreciate your presence this evening. I want to encourage you all to save the information that you're going to receive so that you can make the best decisions. Take notes, share this information with family and friends. Feel free to share it on social media. Ask questions, but most importantly, share the information so that we could dispel all of the myths that we've been hearing about in the community. Thank you again, Assemblymember Bichotte Hermelyn, for the opportunity to join you all this evening.
Good evening, everyone. Good evening, everyone. Thank you, both Assemblymember Rodneyse Bichotte and Councilmember Farah Lewis, and thank you for hosting this event to bring information to our community about the vaccines. I would now like to take this time to introduce our panelists. We are going to start first with our panelist, Dr. Wayne Riley. Dr. Wayne Riley is the president of the State University of New York, SUNY Downstate Health Sciences University, a distinguished physician, internist, academician, clinician, educator, and administrator. The institution that Dr. Riley leads is the only academic medical center serving Brooklyn, New York, one of the most diverse communities in the nation. Since his appointment, Dr. Riley has worked to achieve high levels of excellence across Downstate's medical enterprise. He also holds the tenured rank of Professor of Medicine and of Health Policy and Management. In December of 2020, Governor Andrew Cuomo appointed Dr. Riley to the New York State Vaccine Equity Task Force. Dr. Riley is also the chair of the Board of Trustees of the New York Academy of Medicine, the first African-American chair in the 173-year history of an institution. Immediately prior to joining Downstate, Dr. Riley served as a clinical professor of medicine and adjunct professor of healthcare management and health policy at the Vanderbilt University School of Medicine. From 2007 to 2013, he served with distinction as the 10th president and chief executive officer of Meharry Medicine Medical College. He began his career at Baylor College of Medicine, where he rose to vice president and vice dean for health affairs and governmental relations. During that time, he also served as assistant chief of the medicine service at Bentog General Hospital, the safety net teaching hospital serving the indigent and uninsured of Harris County and Houston, Texas. Prior to pursuing a career in medicine, he served in 3 capacities in the office of the mayor, city of New Orleans. And this bio for Dr. Riley is extensive, so we have condensed it a bit. At this point, what I'd like to do is introduce you to Dr. Wayne Riley.
Great, well, thank you and good evening. Thank you for the wonderful opportunity to participate in this very important panel led by 2 outstanding public servants, and that is Assemblymember Bichotte Hermelyn and Councilmember Farah Lewis. Thanks for your leadership, honorables in all walks of life here in New York City and in Brooklyn. I'm also delighted to be with 2 outstanding doctors, Dr. Foote and Dr. Wallach, who I'm sure we'll all kind of be singing from the same hymnal in a sense very shortly about the vaccines, but delighted to see those 2 outstanding doctors and thank them for all the great work they're doing with health and hospitals and the New York City Department of Health and Hygiene, Mental Health and Hygiene. So let me cut to the chase, Honorable. These vaccines are incredibly safe. And as a member, not only as a member of the governor's Vaccine Equity Task Force, but as a specialist in internal medicine, which is the treatment and care of adult patients, as an African-American physician, I want to assure everybody who's listening tonight that these vaccines are very safe. And I'm going to go into the details about vaccines. But let me step back and say, let's talk about vaccines in general. We've all grown up getting vaccines, by the way. From the day you were born virtually up until probably you went off to college or went into the workforce, you've been taking vaccines all your life. And it's estimated today that if a baby is born tonight, anywhere in the country, that between now and the age of 16, they would have had about 18 different vaccinations to protect them from what we refer to as vaccine preventable illnesses. And so vaccine preventable illnesses are such things that we've heard about, but we rarely see. I'm a physician who's never seen a case of polio because we have a polio vaccine that we give to children when they're young. I've never seen a case of diphtheria because we give diphtheria and tetanus immunizations all throughout life. So vaccines are very common. And if you've gone to college, you've gone to in certain occupations, you've gone in the military, you're required to get vaccinations as part of a condition of you going to college or going into the military. And so now we fast forward to the fact that we have a pandemic, a worldwide pandemic with a very deadly virus. And people often ask me, well, Dr. Riley, what's the difference between the flu and COVID-19? Well, there's a big difference. Number one, it's 10 times more deadly. And the best way to illustrate that is that the flu, people forget that the flu kills about 30 to 50,000 people a year in the United States. But by sometime end of this month, early next, COVID will have killed, unfortunately, 500,000 people. So COVID-19 is 10 times more deadlier than the flu. You can think about it that way. And that's why there was a focus on getting a vaccine that could prevent so much death and disability, in the United States and around the world. So here we are in February of 2021. It's been about a year since COVID hit us. As a matter of fact, the first case in the United States happened on MLK holiday last year, meaning January 21st, 2020. And here we are past the MLK holiday and about to get the President's Day. And we've got, so many millions of cases and unfortunately so many deaths in the United States because of COVID. But it was about around this time last year that we were able to, the Chinese scientists, remember it started in China, the Chinese scientists published the genetic code for COVID-19 end of January last year. So within weeks, scientists all over the world were taking the genetic code and then going into the lab, and they were sort of pulling things off of the shelf in the lab, if you will, to say, okay, we tested this vaccine in some other things that didn't work, but let's see if it'll work with, now that we have the genetic code, let's pull that off the shelf and see if we can come up with a safe and effective vaccine for COVID. And so that is the first thing I try to make sure people understand, because I asked them, well, Doctor, how in the heck can we get vaccines so quickly? And the fact of the matter is, friends, is that it's quick, but it really isn't that quick. The mRNA technology, you may have heard mRNA technology, has been around since the late 80s. So it's not new. It's new, but it's not new. Now, what's new about it is that we were able to pull it off the shelf, if you will, and to ramp it up into massive production to produce hundreds of millions of doses of vaccine in the case of the Pfizer and the Moderna. And I'll talk about the differences about both of those. So the first thing I want to dispel people is it's new, but it's not new. The technology has been sitting in the laboratories of scientists around the world since 1989, and it finally found a good use for that mRNA technology in the form of creating a vaccine for COVID. I think one of the worst things that President Trump did, of which there are many, by the way, is that he called this Operation Warp Speed. I never would have called it that. It should have been Operation Safe Vaccine, because these vaccines are incredibly safe. And I myself have had 2 doses of Pfizer. I feel perfectly fine. It was no worse than getting my annual flu shot. My arm hurt a little bit for a day, and that was it. Slept like a baby after both shots, had no problem. I think after the second shot, I maybe had a little runny nose, but that was it. Never missed a day of work, never missed anything. And again, the beauty of these vaccines is that the data suggests they are very safe. And you say, okay, Riley, tell me about the data. Okay, I'll tell you about the data. So remember, there's 2 vaccines that have been approved thus far. We're going to get to the Johnson & Johnson, which may get approved in the next couple of weeks. But in the case of the Pfizer vaccine, because that's the one I had, the Pfizer vaccine was tested in 153 locations around the world, most of which were in the United States. It was tested in 16-year-old and up. And there were 43,000 patients roughly in the clinical trial who either got half of the patients got Pfizer, half got placebo. So in other words, the study subject, when you're a study subject, you don't really know if you get the study drug or you get a placebo because the syringes look the same, the liquid looks clear. You have no idea. Only the investor, sometimes the person giving you the shot doesn't even know. It's the people back at the data center who knows which patient actually got the vaccine versus the placebo or the saline shot, right? So out of that 21,000 who got the vaccine, listen to this, out of 21,000 individuals who got the study vaccine, the Pfizer, 909 got COVID. And then, I'm sorry, died rather with COVID. And then 21,000 who got the placebo had much worse outcome. So that's the Pfizer vaccine. Second one is the Moderna vaccine. 99 sites around the world, split in half. 15,000 got the placebo, 15,000 got the vaccine. Out of the ones who got the vaccine, only 11 got COVID, whereas in the ones who got the placebo, 185 people got COVID. So you can say 185 versus 11, et cetera, et cetera. So you can see that the data indicate that these vaccines, when you look at all the statistics, are 95 and 94.5% effective. That is pretty darn good. And again, the key thing is that there were no deaths, or very few deaths in anybody who got any of these vaccines. So that underscores, Dr. Wallach and Dr. Foote will tell you, that is, for us as physicians, that is very comforting that vaccine prevented that much illness. And that's why they're deemed to be incredibly safe. The other point is, we've all had coronavirus in our lives, but just not this one. We've all had the common cold, and that's why this is called novel coronavirus 19, because there's 18 other coronaviruses that have been discovered in humans before this one. And those are the ones that we have all had. So this one is part of the coronavirus family, but it's much more deadly, much more transmissible. That's why it's much more dangerous. And then the final point before turning it over to, again, my two distinguished colleagues, people say, well, I'm not sure, doctor, if I get the vaccine. And I said, look, you strongly need to consider this vaccine because of what the council member and the Assemblywoman just mentioned. This has been hammering Black and brown folks, not only in New York City, but all over the country. This has been very bad for our community. So if we can prevent this from getting any worse, that will save lives, save your family's grief, et cetera. And I tell people this is very simple as a physician. The vaccine does four things. Number one, it keeps you out of the hospital. It keeps you out of the ICU. Number two. Number three, it keeps you off the ventilator. And most importantly, number four, it will keep you out of the funeral home. And I want to underscore that. It prevents death. And that's the reason why we need to consider, all of us who are African American and Latino American, getting this vaccine, because it will prevent the worst effects of a very deadly virus from affecting you potentially bringing it home to your families and your loved ones, and prevent you possibly from becoming disabled because of the long-term effects of COVID, which we are only now beginning to understand. So with that, I will turn it over to my two distinguished colleagues, and I look forward to further questions.
Lisa, you're on mute.
Thank you, Dr. Rowley, for that information. We would like to have you join us for Q&A after our other panelists join us. So I would now like to introduce our next panelist, which is Dr. Andrew Wallach. Dr. Andrew Wallach received his undergraduate degree in history, cum laude, from Duke University and his medical degree from the University of North Carolina at Chapel Hill, where he also completed his residency training in internal medicine. At New York City Health and Hospital Bellevue, he served as the ambulatory care chief. In this role, he leads the ambulatory care service line and works with the clinical chiefs to improve access, quality, and patient satisfaction throughout the ambulatory care. At New York City Health and Hospitals, he serves as the ambulatory care chief medical officer. In this role, he is responsible for leading the overall clinical vision for ambulatory care throughout the enterprise in order to provide high quality medical care for patients, as well as to align staff to meet the changing environment in healthcare. Throughout the 2020 COVID-19 pandemic, he has led the testing initiative and COVID-19 vaccination efforts at New York City Health and Hospitals and was named Chief Medical Officer for the New York City Test and Trace Corp. He is currently an Associate Professor of Medicine in the Department of Medicine, Division of General Internal Medicine and Clinical Innovation at the NYU Grossman School of Medicine. I would like to now introduce Dr. Andrew Wallach.
Great. Thank you so much for that very warm introduction. I am really honored to be here tonight, especially among such distinguished speakers as Dr. Riley and my friend, Dr. Foote. I'm a very visual person, so if you don't mind, I'm going to share some slides of a presentation that might be easier for folks to be able to follow along. So just give me 1 second. I'm going to put us into slideshow here, make it a little bit easier. Okay. And are you all able to see my slides?
Yes.
Wonderful. Okay. So this is the culprit right here. And I show this for a couple of reasons. Number one, this is the SARS-CoV-2 virus that causes COVID-19 disease. And I show it up, number one, because it's actually a very beautiful virus. But in particular, what I wanted to point out are these red triangles that are on the surface of the actual virus. And these are the famous spike proteins that we've been hearing about and are very critical to the success of our vaccines because they target these specific proteins. So I wanted to show an image of that. Now, before we get started, I did want to spend a little bit of time just talking about vaccines in general. Dr. Riley went over some of this already, but just to remind ourselves that traditionally in the past, vaccines are weakened forms of the bacteria that we inject into the body in order to elicit an immune response. In this particular case, however, as we heard, the vaccines that we're using so far to date are these messenger RNA or mRNA vaccines that actually are a little bit smarter. They use the virus's own genetic code, or what I would call recipe, to instruct our own cells within the body to produce a protein that then triggers this immune response to the virus. And so, again, as Dr. Riley said, these are not new vaccines. There has been research going on for mRNA vaccines for many, many years, but this is the first time we are using them to fight particular disease. And this is an issue my patients bring up very often to me is, Dr. Wallach, how can it be that we develop these vaccines in such a quick time? And again, I remind them that this research has been going on for quite some time. The two vaccines that have received authorization under emergency use from the FDA are the Pfizer and the Moderna products. And again, I would just say that our prior research has really led to this quickened timetable for the development and trials, and that all of the information that was presented to the FDA is based on hard science. Nothing was skipped in the process. These have been well vetted and well studied. I myself, unlike Dr. Riley, he had the Pfizer vaccine. I've had my 2 doses of the Moderna product. This is just a little cartoon that I thought might be helpful to understand kind of how these messenger RNA vaccines work. And basically, you can see this bubble to the right of the screen. It's essentially a fat particle that has within its core this messenger RNA, or again, as I said, a recipe for the cells, as you see to the left, to be able to produce this spike protein, that red triangular shape that I showed you at the beginning. This is then released out into the body, and your body produces an immune response in order to protect you. Now, a key element about the safety of these messenger RNA vaccines is that this messenger RNA or recipe never enters into the nucleus or the center of the cell. And so once it is used to make the spike protein, your body destroys it. Again, you'll hear a little bit more from my colleague, Dr. Foote, about vaccine distribution, which is being handled by the health department. Right now, for the 2 vaccines that have received emergency use authorization, you do need 2 doses. The Johnson & Johnson product, which will be going before the FDA, I believe, in just a week, only requires 1 dose. A point I would like to make, though, is that if you are receiving the Pfizer or the Moderna product, you will need those 2 doses, and both doses will need to be delivered at the same site. So if I went to Bellevue Hospital for dose 1, dose 2 also needs to be performed at Bellevue Hospital. Similarly, if I got the Moderna vaccine as my first dose, my second dose will also need to be Moderna. I cannot interchange it with the Pfizer product. Both of these vaccines are intramuscular injections in the upper arm. Right now, these are voluntary vaccines, although we hope all New Yorkers will sign up and get their vaccination. And again, based on the data from these very large clinical trials that Dr. Riley shared with us, not to mention the fact that we've had now real-world experience with vaccinating folks, they appear very safe, and we continue to monitor them long-term. Very rarely, as you've heard reported in the media, some people will have an anaphylactic or reaction where they develop hives or difficulty breathing. Again, thankfully, these are very rare occurrences and are not specific to the COVID vaccines. They can happen with other vaccines as well. What we have seen, however, are high rates of what we call temporary and unpleasant, but not dangerous side effects. And so what are some of those side effects? Well, probably the most common are pain and swelling in the injection site, again, in your upper arm. Some people can develop fever and chills and the sense of feeling very tired, and some will also develop a headache. Again, looking at the clinical trials, the majority of these folks who've had these side effects really occurred more commonly after their second dose. And this gets us to this concept of vaccine reactogenicity. And again, this is how your body responds to these vaccines. And it's really important that before we inject anybody, we let them know and we counsel them about what to expect. These are known effects from the vaccine, and they should not be alarming to an individual. And in fact, unless a person develops a strong contraindication or reason not to take the second dose of the vaccine, even if they develop a headache or some fever after that first dose, they should complete the series and get their second dose. If you do have any symptoms, you can take things like Tylenol or Advil, ibuprofen to help with the symptoms. But at this time, I'm not recommending that people take this to prevent them. So meaning I get my injection, I feel terrific, but I'm going to go home and take some aspirin or Tylenol to prevent symptoms. At this time, I would only recommend taking those medications if you need them, if you should develop some of these common side effects. Again, they do not occur in everybody, but just a portion of the folks who receive their vaccination. So I want to switch gears a little bit to talk some more about the virus itself. So like other viruses, the SARS-CoV-2 has what we call developed variants to the original virus. Again, this is not unique to COVID, and in fact, many viruses will mutate or develop variants over time. Right now, there are 3 main variants that we're really focusing on. The first one is from England, it's the B117. The next variant is from South Africa, the 501.V2 strain. And then lastly, and more recently, there is a new variant coming from Brazil known as the P1. Now, why are these important and where are they? So this is a schematic of the United States, and you will see by the darkening colors the increasing prevalence of these 3 different types of variants. And so just to point out the obvious, that number 1, New York City, which is in the light green, New York State, including New York City, has developed or has picked up these variants, but more commonly in California and Florida, we've seen much more of these variants circulating in the community. So why does this matter? Why do we worry about them? Well, this is what we know about the variant strains as of today. And I want to be very clear that what I'm going to tell you is the best knowledge that I'm aware of as of February 9th, 2021. This may be subject to change, but as of right now, what we know is that these variants spread more easily. They're easier to transmit to other individuals. Our current vaccines, however, do appear to recognize these variants and therefore offer levels of protection.
Sorry, Dr. Wallach. You are muted. Dr. Wallach, can you hear me? You are muted. Dr. Wallach, can you hear me? I can't. Excuse me, everyone. We're trying to get Dr. Wallach sound back. We're having a little technical challenge right now. Please bear with us. Dr. Wallach, can you hear us? We cannot hear you, Dr. Wallach. You went through that.
Can you hear me now?
Yes.
Okay, sorry. I guess I lost my my video. I apologize. So I'll just start with where I left off, and I apologize. But basically, I was talking about the concept of herd immunity, and that in COVID in particular, we estimate that you need to have 60 to 70% of the population protected before we can develop herd immunity. And this, again, is just another cartoon to show you how herd immunity works. The blue individuals are susceptible. The red individuals are affected, and you can see on the left-hand side of the screen that if people are susceptible, it spreads very well. On the right side of the screen, the green individuals are immune, and therefore it is much harder for it to spread. We passed a milestone yesterday in New York City, and that over 1 million of New Yorkers in New York City have now received vaccine. And this is really wonderful. So we're very excited about this milestone that we have reached. And so lastly, what I wanted to mention is the core four. Again, Mary Foote has taught me this very well. We are not out of the woods, even with the advent of vaccine. So just to take a moment to remind ourselves of the importance of social distancing, meaning keeping 6 feet apart from one another. If you're feeling ill or sick, please stay home from work and remain in your home until you feel better. Wash your hands regularly. And then of course, perhaps most importantly, when you leave your home, make sure you wear a mask. In fact, there are some studies to show now that wearing 2 masks together offers even a greater level of protection if that mask is not of medical grade. So I apologize for the audio issues. I hope that you were able to hear at least the beginning of my comments, and it is at time, so I will pause here. And again, thank you and apologies.
Thank you, Dr. Wallach. We appreciate you sharing that information with us, and as well, we hope to have you be part of our Q&A session after our final panelist speaks. So at this moment, I would like to introduce you to our third panelist, which is Dr. Mary Foote. One moment, Dr. Foote. Dr. Mary Foote is the Senior Health Security Specialist in the Bureau of Community and Healthcare Readiness in the New York City Department of Health and Mental Hygiene, Office of Emergency Preparedness and Response. Since 2015, she has overseen New York City's Department of Health and Mental Hygiene's Communicable Disease Preparedness Program, aimed at maintaining and enhancing healthcare readiness for emerging infectious disease and supporting interagency communicable disease response planning. In her incident command system role as Healthcare System Support Director, she was critical to the department's successful response to measles, Ebola, Legionnaires, and Zika, and has been on the front lines for New York City throughout the COVID-19 response. She earned her MD and MPH from the University of Arizona and completed a residency in social internal medicine at Montefiore Medical Center in Bronx, New York, before going on to Emory University in Atlanta to complete the fellowship in infectious disease. In addition to her work with the Department of Health and Mental Hygiene, Dr. Foote also maintains a clinical position at Colin Lord's Community Healthcare Center in New York City. Let's please welcome Dr. Mary Foote.
Great, thank you so much, Assemblymember Bichotte Herman, and thank you for the invitation also, Councilmember Lewis. It's really a pleasure to be here to share what we're doing with your constituents. And also thank you, Dr. Riley, for putting me to shame. I've been admiring your work from afar for a long time, so it was a pleasure to hear your presentation. And Dr. Wallach has been a great friend of the DOH throughout this response, so it's been a pleasure to be on a panel with you. So can we go to the next slide? So I just wanted to start out by setting the stage of where we are right now in the trajectory of the epidemic in New York City specifically. We have more recently in the last month or two, basically since December, been seeing a steady uptick in cases, which just recently, I think over the last week or so, is hopefully in terms of cases and hospitalization looks to be plateauing and hopefully on a downward trend. We are seeing persistent and hopefully plateauing levels in the Bronx and Brooklyn, but throughout the rest of the city, we're seeing positive trends. Next slide. And so this really is not a time to be complacent, even though we have, positive trends and we have the vaccine rolling out, we still have a lot of work to do to stop the spread. So Dr. Wallach will tell you as well, it's all about making sure, in addition to getting vaccinated, we need to make sure anybody everyone has access and does get tested if they need it, if they've been exposed or have symptoms. And of course, follow the core 4 that we love to talk about, staying home if you're sick, unless you need medical care, and wear your face covering and make sure it's appropriate face covering. We're really looking for multiple layer cloth masks or medical grade masks at this point, keeping 6 feet of distance from anyone outside of your household, and make sure you're continuing to wash your hand and stay out of crowded spaces. And of course, if you are an older New Yorker or have older or vulnerable family members at home, we also recommend that as much as you can, try and stay home and reduce your risk of transmission. Next slide. Next slide. Okay. And so we're going to talk a little bit about our vaccine program as it stands right now, how we are distributing and delivering the vaccine throughout New York. So right now we have a very strong focus throughout the response, but in particular, we're very cognizant of equity in our vaccine efforts, and with a real acknowledgement of the longstanding history and current experiences of racism and bias in healthcare and communities significantly impacted by COVID-19. So we've seen, a long history of disparities and systemic racism really manifest in a tragic way during this pandemic, and we really are aware of the very pressing need to make sure that these highest risk populations are well protected with the vaccine as well. So with that, we're working to ensure both access to and hopefully instill confidence in the vaccine. And having champions such as Dr. Riley really helps, and that's really something that we hope to continue to partner with our medical and community partners to really champion. So next slide. And looking at the vaccine basics, I think these have already been covered very well by our previous speakers, but the take-home message is that the vaccines are safe. They've undergone the same type of rigorous testing that any other medication or vaccine would go under. They are definitely absolutely recommended, even if you've already had COVID-19 previously or have positive antibodies. These vaccines do not contain a live virus. It does not alter your DNA in any way. And so these are real key messages that we want to get across. So right now we have the 2 authorized vaccines that are available in the United States, the Pfizer vaccine and the Moderna vaccine. Both are the mRNA technology and both require 2 doses. With the Pfizer, it's about 3 weeks apart. With the Moderna, it's 4 weeks apart with a little bit of extension wiggle room. Second dose appointments, if you are getting vaccinated at a specific site, especially a city site or at a clinic, really it's recommended to get your second dose appointment at the same location as the first. And one thing that we really want to emphasize, and I know this is not what people necessarily want to hear, but it's really important that even when you get vaccinated, that people must continue wearing face coverings, keeping physical distance, and limiting gatherings. And there are many reasons for that. Really, the most important thing is, we know that the vaccines and in the trials have demonstrated that they're very good at keeping people from getting severely sick or developing symptoms from COVID, but we're not totally sure how well it works against preventing asymptomatic or infections without symptoms, where you may be, you might say you could be a carrier of the virus, and that means you could still transfer it to other people. So until we have really broad vaccination and know a little bit more about what we're dealing with in terms of, whether or not somebody can transmit the virus after vaccination, it's really important to protect, your loved ones and your community by continuing to follow the core 4 after vaccination. Next slide. And so how are vaccines getting to New York City? The vaccines are being federally managed by the federal government, and then they're being shipped directly to the sites or the city from manufacturers to the states and localities. For the hospitals, they're getting, and a lot of our sites, they're getting them directly shipped from the manufacturers. And New York City, in terms of nationally, New York City is receiving an allocation proportionate to its population. And that is the same in how it's allocated throughout the United States. And I just wanted to direct you to DOHMH now has a really great website on how we are doing in terms of vaccinating, in terms of numbers. And Dr. Wallach stole my thunder that we have announced that we have now reached over 1 million New Yorkers vaccinated, which we're very excited about. So you can follow those data on this vaccine page to learn more. But I think it's really important to note that this is still vaccines are still a precious and limited resource. We need additional vaccines from the federal government to really ramp up operations. We have a lot of capacity, just not a lot of vaccine to deliver. So, in the meantime, we are getting well positioned with our colleagues in health and hospitals and with our healthcare partners to open up additional sites. Hopefully, as soon as we get more vaccines in hand, we can start offering a lot more appointments so we can vaccinate more New Yorkers. Next slide. And so right now we are still in the phased distribution model. So the CDC determines who are the priority groups and what are the tiers for prioritization. And then New York State is really the one that's determining how to operationalize that prioritization in terms of, what order and what speed that the vaccine is being offered to these different groups and at what timeline. So right now, people at increased risk of exposure or of severe COVID-19 are right now being prioritized for vaccination appointments. And this includes healthcare workers, people 65 years or older, residents and staff in nursing homes, homeless shelters, or other group residential facilities. And also we're making it available to certain frontline essential workers, such as grocery store workers. We now have opened up to restaurant workers, transit employees, police, and other frontline workers. And we were very excited to see recently announced that starting on the 15th, so on Monday, vaccination will also be open to people with certain high-risk underlying health conditions. So for a full list of who is currently available, you can keep checking this link at nyc.gov, COVID vaccine distribution. So really what we want to impart is that this phased distribution will take time, especially given the speed at which vaccines are being produced and distributed. So we don't really expect to have vaccines widely available to the full general public until at least mid-year this year, mid-2021. So we're just really want to make sure that people are understanding of that and waiting turn for their vaccine, but as when they're eligible, please be encouraged to go out and get them. And we are doing our best to make sure that appointments are available for you to do so. Next slide. And so how are we enhancing access and building confidence in vaccines? As mentioned, our COVID response throughout has been really grounded in equity, and this focus really continues and is even more important with the vaccine campaign. And we realize that successful and equitable distribution is two parts. One is enhancing access, but also really building confidence in the vaccine. So we have seen even people that have been eligible, we have seen trends in hesitation to get the vaccine, a lot of questions still. People are waiting to see other people get vaccinated before they get it. So we're really trying to improve that confidence, to improve acceptance. So data on uptake, as I mentioned, so far are showing disparities that reflects national trends, unfortunately. And so this is partially due to prioritization and eligibility barriers, but also lack of confidence within communities of color that we're working really hard to address with our wonderful partners in the communities and in the healthcare community. We are working with the city's Racial Inclusion and Equity Task Force, which recently increased number of equity neighborhoods that we are prioritizing for vaccine allocation from 27 to 33 neighborhoods. Next slide. And the city is working hard to expand sites to ensure distribution also to pharmacies. And I think the real backbone of getting confidence in the vaccine is to have a trusted healthcare provider to be able to provide it and counsel them. So we're working really hard to make sure that as soon as we have the adequate supply stabilized, that we can have vaccine supplied to local providers that can give it to their own patients. I think that's really important. And so right now, it has been difficult, I know, for people to get vaccines, but we encourage you, to keep trying. Appointments can be made online at the vaccine finder at .nyc.gov, and for city-run sites, you can also call our hotline at 877-VAX4NYC. And we are working hard to continue to improve the user experience. We just had a recent upgrade in our appointment system that should make things much easier and more user-friendly. And we're also continuing to partner with other groups working with high priority populations, such as the Department for Aging providers, NYCHA developments, and community-based organizations to help community members secure appointments, particularly within those 33 prioritized neighborhoods. And just to note, we do have transportation options available to seniors who need them that can be arranged through our call center. And also in terms of accessibility, we have language options that are available for translation on both the appointment app, our appointment line, and on site at the vaccination clinics as well. Next slide. And so how are we working to build vaccine confidence? We are working and realize the importance of having trusted messengers within a community. So we're working with community leaders throughout the city to help spread accurate information and help people also navigate the process, more importantly, to get set up to get a vaccine. We've been doing a lot of really aggressive outreach through town halls, community conversations, train the trainer sessions, doing on the ground outreach and canvassing, direct mailers, text messaging, etc. With trying to do our best to make language accessible materials for the public as well. And I just also wanted to point your attention to a really great video that was recently released, Vaccine Facts campaign, to address key drivers of vaccine hesitancy and also to bust some of the more common myths that we've been hearing. So I encourage you to take a look at that and refer your friends and family to it. Next slide. And again, my thunder was stolen, but we are right now, in addition to having 1 million doses in arms as vaccinations, we have had almost 1.5 million doses delivered to New York City. So that leads to over 716,000 dose ones, and we now have over 200,000 New Yorkers that have gotten their second dose. Next slide. Next, and this is a new resource that we have. We are very aware that it's important to be transparent in our data, particularly from an equity perspective, making sure that we're transparent about race and ethnicity data and by age on who's getting vaccinated. So this is a new page that is available on our DOHMH data vaccine data page, which you can get through our website. And as you'll see, we have the first set of columns. The first set of rows is New York City residents. And if you look to all adults, the percentage of particularly Black and Latino New Yorkers is much lower of those who have been vaccinated compared to their proportion of the population in New York. So that's something that, you know, again, all the reasons that we've talked about, you know, in terms of hesitancy and improving access, that we've been really working on improving and ensuring that we have equitable uptake and distribution. Next slide. So what can we do as New Yorkers and as community members? And first and foremost is get the vaccine. When you're eligible, please, please, please get the vaccine. If you have family members, loved ones, coworkers that are eligible, please encourage them and share any information you might have. And, you know, please go to our trusted websites, the CDC, the City Health website, to find really helpful information that can be shared with others. Also, please, again, keep getting tested and practicing these core 4 prevention strategies. Stay home if you're sick, or a face covering or a face mask, keep physical distance, and wash your hands. And here are just some additional resources for you to take a look at as you want to learn more about the vaccine yourself and to share with friends and family. And thank you. And next slide. Just wanted to share, this was me on Sunday at our Bushwick vaccination hub, getting my 2nd dose of the Moderna vaccine. So we're trying to make it loud and proud when we're getting our vaccine and showing others that we're doing well and minimal issues. I am actually suspicious of how few side effects I've had with my 2nd dose. So you will do well with it. And it's definitely better than getting COVID. It's definitely better than exposing your loved ones potentially to COVID as well. So please get vaccinated. Thank you so much for having us be able to present today.
Thank you. Thank you so much, Dr. Foote, for your information. And this leads us into our Q&A session. So we'd like to bring back our other panelists, Dr. Wallach and Dr. Riley, if you would please join us. Okay, and if you both can unmute yourself, let's just see if we can get the, we have a few questions, follow-up questions, and we also have some questions from our constituents. Let me just try and get our gallery view here. Sorry, one moment. I will start with Dr. Foote, since you are on screen here. I think it's worth repeating. It hasn't been mentioned here in this presentation, but there are a number of people who may not be aware of this. Is there a fee for the vaccine?
Thank you so much for asking that, because that is a question we do get quite a bit. And no New Yorker should be charged for a vaccine. You may get asked if you have insurance at a doctor's office, you may be asked for your insurance information. So your insurance can be billed, but you should not have to pay out of pocket for a vaccine.
Okay, great. And we're in a community, Assemblymember Bichotte Hermelyn, as well as Councilmember Farah Lewis. We are in a community that has a high number of undocumented residents. Are they eligible to receive the vaccine?
Absolutely. They are eligible, encouraged, and welcome.
Mm-hmm. Okay, wonderful. So another question that we have, and I'll address this question to Dr. Riley. If someone has the COVID-19 antibodies, do they still need to take the vaccine?
Absolutely, yes. And the reason why we know that is because we've been following patients who got COVID, for example, last spring and summer, and we see that their antibody response isn't as long lasting as we would have anticipated. So given that, the guidance from CDC and from Pfizer and Moderna in this case is, yes, you should still get the vaccine, even if you do have antibodies, meaning you had some exposure, either you had known COVID or you were found to be having antibodies and you may not have ever realized you had COVID. So the short answer is yes. The only caveat is if you've had COVID, for example, in December, January, the thinking is you shouldn't get the shot till probably March. So there has to be some time period behind when you got, when you were diagnosed with COVID until you get the shot. But if you had COVID last year, for example, before October, you're eligible to get the shot right now, given if you have pre-existing conditions and meet the new criteria that have been laid out by the mayor and the governor.
Okay, great, thank you. And we have a constituent of ours who posed a question. They've received both of their shots, and they'd like to know how safe it is to visit their loved ones. They have a granddaughter.
That is the question of the hour for everybody who's getting shots. I know Dr. Foote and Dr. Wallach have gotten echo, so I'm going to defer to them. They get it all the time too.
And what is it?
Okay, I'll try. Yes. Short answer. And even better if they've been vaccinated as well. So encourage them to get vaccinated. But we do, as I mentioned before, really still encourage you to take precautions, because there we do have a potential for, being essentially a carrier still for COVID. So, you still want to make sure that you're practicing all the appropriate safety measures, such as wearing a mask and trying your best to stay distanced.
Right. Let me give you an anecdote. Follow Dr. Foote here. Dr. Fauci told this anecdote, by the way. He and his wife have gotten the shot. Dr. Fauci, who's got a national treasure. And he said that he and his wife only will socialize with other couples who have had the shot. So to underscore the point, that we still have to be careful. And obviously CDC will be given some guidance as we get more Americans vaccinated. But if given the choice of interacting with your family members who have not gotten the shot and those who have, definitely do the family members who've gotten either Pfizer or Moderna before you visit relatives of your family who have not yet gotten the shot. That would be the safest thing. In addition, as Dr. Wallach said, we still have to mask. We still have to, not put ourselves in super spreader events. Not go to big gatherings. We all miss going to church. No, you can't go to church. You can't go sing, even if you've gotten a shot just yet. Now, maybe by the summer, early fall, we can start doing that. But we've got to get more people in our community, more people in New York City vaccinated, because the sooner we get more people vaccinated, then we can start relaxing some of these, restraints that we've all had on our life for almost a year now.
Yeah, and I completely agree with my colleagues and say that's probably the number one question I get from grandparents is, when can I visit my grandchildren, right? I've gotten my vaccine, it's safe. And, and it's a hard answer because I end up telling people is, even though you've been vaccinated, as my colleagues just mentioned, your behavior should not change. And so you still need to continue all these precautions. And what I say is that, every decision we make is a risk analysis. And if you decide that you are going to visit with family, you need to continue the same precautions as before. As Dr. Foote said, even though you've been vaccinated, you still can be a carrier potentially of having infection without symptoms. And so I would not feel comfortable advising someone who's been vaccinated to go and visit family and take their mask off and share a meal at this point, until we get a larger percentage of the population that have actually been vaccinated and we start to approach some of that herd immunity. So a little while longer. We've come this far.
And that goal is 60 to 70%, as you mentioned, to reach herd immunity, correct?
Right, correct.
Okay.
Yeah, and you could also still consider getting tested before, visiting with or
That's right.
socializing with any high-risk family
Right.
members or loved ones.
And even, and then again, Dr. Fauci said, look, even if you're in a situation where you have to interact with family members rather, do it outside. Now, we can't do it outside in New York City tonight or this week because it's too much snow. But if once we get to the warmer or maybe, not blazing hot part of our summer here, but once we can sit outside comfortably with a jacket on, that separated 6 feet apart in a park or in a backyard, that's probably okay. That's much safer, but not inside, not in a setting where you're in a whole bunch of people, et cetera. So again, listen to the experts. So we've got two great experts from on this video today, and they're dead on target.
And I would add, kind of my day job, if you will, is being very involved with testing for COVID-19. And I just didn't have time to go into it in my remarks. But, as we've been saying, just because we have the vaccine now, it doesn't mean we don't need to test anymore. Testing is just as important now as it's been throughout the pandemic. And that's one of our main thrusts here in New York City. And quite honestly, one of the things I'm most proud about our amazing city is that if you think about it, we live in the largest city in the US, and we live in multi-generational dwellings, and our apartments, our homes in New York are smaller. We live on top of one another compared to the rest of the country. And despite all that, due to the health efforts of our Department of Health and Mental Hygiene and New York City Health and Hospitals, we've been able to maintain the lowest transmission rate of any major city in the US. And that's not just luck. That is the strategy of our mayor and city hall and our health officials. And a big part of that starts with testing. And so if nothing else tonight, sorry to sidebar, but I would say get tested regularly. Again, there is no cost if you get tested at a New York City Health and Hospitals location. There's no administrative fee. We don't ask about immigration status. If you have insurance, we will bill them. But the bottom line is come out, get tested frequently.
So Dr. Wallach, I just want to make sure that our audience is clear. You're suggesting that the testing should continue even after you have been vaccinated?
Yeah, absolutely. I think that if you have been vaccinated and you're going to visit somebody who has not been vaccinated, high risk, and again, an example would be if I'm visiting my elderly parents, there is no downside in getting tested and assuring that I am without the virus, because again, for another night, and we're happy to come back, but we know that a large number of folks who have COVID infection can actually be without symptoms or pre-symptomatic before they, start to show those symptoms. So testing is just really critical to making sure that we maintain the safety of our loved ones.
Do you find that there's an increasing amount of individuals who are getting COVID without the symptoms? Like, we didn't hear much of this at the beginning stages of COVID, but now that we have progressed a little further, do you find that we have a much larger pool of people who have no symptoms but do have COVID?
Yeah, I think that's a really outstanding question. And I would say it's a little complicated in the answer. And there are two reasons why. Number one, if you recall, and Dr. Foote knows this well, because we had many conversations early on of, are we allowed to test this person? We don't have to test. Can we test them this week? Can we test them next week? So, back early in the spring, it was really hard, right? We were telling people, stay home, don't come and get tested because we don't have enough tests. I think throughout the course of this past year, as we have ramped up the availability and access to testing, we are now doing on average in New York City, 60 to 80,000 tests per day. New York City Health and Hospitals alone is doing 20,000 tests per day. I will tell you, over the summertime, 6 months ago, if we did 3,000 a day at New York City Health and Hospitals, I was very happy. So I think all of that to say is that we are learning a lot as we test more people, and we are learning that we are picking up more cases of folks who are without symptoms, or again, what I'm calling pre-symptomatic, meaning we can actually see that they're positive and that they don't develop symptoms until a day or two later. And I think that's just reflective of the fact that we're doing a much better job of testing people, getting this information that we didn't have earlier on in the pandemic.
Okay.
Yeah, and I thank you, Andrew. You said it beautifully. Just to add, from more recent data and literature that we've been seeing, it looks like actually up to 40% of people that test positive do not have symptoms when they get tested.
Right.
And the CDC recently released a study that showed that an estimated almost probably around 50% of COVID transmission, meaning people spreading it to others, about 50% of that is happening from people who do not have symptoms.
Right.
So it's still a big risk and concern, much more than we realized earlier on.
I agree with that. Yeah.
So here's another question from one of our constituents. Since we had a race to try and produce as many vaccines as possible to cover all, I think it's great that we have so many people who want to get the vaccine, because at the beginning of this, there's a lot of people very concerned. But now we have a good number of people who want to get the vaccine, and we're at a race to produce enough to vaccinate all the people who want it. There's a concern about the effectiveness of the vaccines down the road. If there's going to be a new vaccine coming out, or of the 3 vaccines that we currently have, will it still maintain the same level of effectiveness as it had in the beginning?
That's a great question, and it's something that scientists all over the world are working on. And there was some news earlier today that I think Pfizer has now come out and said that their vaccine is partially protective against the variants that we're worried about. And we know this about viruses. Viruses mutate all the time. But the best way to decrease the mutation of a virus is to stop their replication. In other words, their transmission in the population. So even if a vaccine is not 100% effective, it's still going to be important that you get that vaccine. For example, we're going to see the data from J&J very shortly. And some people may be saying, why would I take the J&J vaccine when it only appears to be 72 or 85% effective or whatever? It's less than the 94, 95 of Moderna and Pfizer. But look, the goal of a vaccine is to keep you from, as I said, dying, getting really sick, and going in the hospital. If you just get COVID and you just feel bad for a couple of days, that's much more, and we tell you to get away from other people so you don't spread it to your household, we quarantine you. That is a good result too. So no, don't underestimate that. Even, this, I think the J&J vaccine is going to be a game changer because it's one shot. And we know in the Black community, we don't like shots. We don't like going to hospitals. I have members of my own family, I don't like going to hospitals, Wayne. Well, okay, fine. Go to Yankee Stadium, go to CVS, just get it, right? And the fact that we can, with the J&J, you can go one time and you can get up to between 72 and 85% protection. That's good enough. That is very good and good enough for right now. Now, next year at this time, they may have, remember Dr. Wallach talked about that recipe, that genetic code. Well, guess what? We can modify the recipe in vaccines by adding in a little bit more to deal with the UK variants or the Brazilian variant. So that's the beauty of this new technology, is that it's easier to doctor up the recipe, as opposed to the older generation, the old school vaccines, if you will, that took years or months to make the changes in the recipe. So that's even another reason why we should embrace this technology, is that it can be modified quickly. So even if, the variants are a problem 6 months from now, in 6 months from now, the vaccine manufacturers will likely have come up with a slightly improved recipe for the next few versions of the vaccine.
Someone has asked, since we're talking about the Johnson & Johnson, someone has asked, does the Johnson & Johnson have the mRNA in their vaccine?
Yeah, so I'm glad they asked that question. I was just going to say about the J&J product, which again, we're waiting for formal emergency use authorization from the FDA. But one of the other advantages to the J&J product, which is not a messenger RNA vaccine, it is a different technology, But one of the other advantages, besides the fact that Dr. Riley points out as a single dose, which is really important, it is much more stable to handle. It doesn't require this ultra cold freezing and thawing that the mRNA vaccines do. So from my perspective, that is a real advantage, especially when we start to think about individuals who are homebound, can't leave their apartments or their houses here in New York City. It will be much easier for us to be able to take vaccine to them in their apartments using a product like Johnson & Johnson, which is much easier to transport as opposed to Pfizer and Moderna. So again, to Dr. Riley's point, getting vaccine into people's arms, regardless of which brand, is the most important to be able to start to develop that herd immunity and protection across the board. And in particular, from a logistics perspective, we didn't even go into, as part of Operation Warp Speed, the ridiculousness of planning that they had to go through. It's unbelievable. They've literally built freezer farms, right, to handle these vaccines and then get them onto FedEx and UPS planes and get them delivered. It's a big operation. So I am very excited about the Johnson & Johnson product myself.
Yeah, and I'll just add to that I mean, in the trials, so in the trials, over 22,000 people were tested. There were lots and lots of COVID cases in the non-vaccine receiving comparison group. And in the group that received the Johnson & Johnson vaccine, there were no hospitalizations or deaths. So that's again, going back to what Dr. Riley said, that's really the take home. That's where the money is. You want to make sure that you are protected from severe disease and severe consequences, including death.
Right. Now, the reason why Dr. Foote is absolutely correct. One of the reasons why we want to keep people out of the hospital with COVID is that the data suggests in New York City that if you went into the hospital, you had a 3 in 10 chance of not surviving going in the hospital. About 30, in the early days of the pandemic, it was 30% mortality. So out of 10 people, 3 people didn't get to go home and hug their loved ones. And if we can prevent them going in the hospital, that's good for everybody.
Wow, okay. So the Johnson & Johnson seems to be a great vaccine, and it's much easier to manage and administer, where we have only 1 versus 2. So what will the production look like now for the Johnson & Johnson vaccine? Are they planning to produce at a much greater rate?
Yeah, well, again, this is Dr. Wallach talked about the logistics. Johnson & Johnson apparently already has 100 million doses already manufactured. So right now it's sitting in storage somewhere. So as soon as the FDA grants emergency use authorization, that'll start shipping out. Now, if the data are presented to the CDC and the ACIP and all the committees it has to go through, it's quite possible by the first week of March, we could have J&J being distributed. And with 100 million doses sort of, flooding, the country, that's going to be very, very helpful. The other thing, it's a funny analogy, but I think people get it. People ask us all 3 of us, what's the difference between, these vaccines? And just a humorous way to remember this. Pfizer and Moderna are like Coke and Pepsi. They're both colas. There may be a little difference,
right.
But they're like Coke and Pepsi. All right. So it's specifically with Moderna, you got to store it at, I think only minus low, like minus 20 or so. Whereas with Pfizer, it has to be minus 70 storage, right? Really, really cold. And one is Pfizer, you can be 16 and get it, and Moderna, you have to be 18. So the next way to think about the J&J is that J&J is going to be the Sprite version.
Dr. Pepper.
Yeah, or the Dr. Pepper. You like Dr. Pepper.
I love Dr. Pepper.
Yeah, she must have some Texas roots there. That's Dr. Pepper thing. But again, I'm being humorous, but that I think people understand. Oh, I got it. Coke and Pepsi are colas. They're a little bit different, but they work the same way. Whereas Sprite or Dr. Pepper is not a cola technically. And J&J is going to be in that other group. And then we hope to have another vaccine maybe by midsummer. Help me out, guys. Which one will likely be next? Novavax, you think?
Yeah, we have AstraZeneca.
Yeah, or AstraZeneca.
Yeah. So by July 4th, we could have 4 vaccines. That would be great.
Okay, so we have about 3 minutes left, and I have about 5 more questions. I just want to get through these quickly before we do end and provide as much information to our audience as possible. When will kids be able to receive the vaccine? And will they be required to receive it to go back to school?
So I would say right now, there is no requirement, as I mentioned in my remarks, for taking the vaccine. I think that is something, a conversation will evolve over time, but right now I think our message is let's get vaccine into as many arms as possible, as quickly and safely as possible. As far as children, a lot of these initial studies that we alluded to, these clinical trials did not include children at the time. They also did not include pregnant women. And so these companies are actually now continuing to study the vaccines in those particular populations. And we're just going to have to wait for that data to be released. So hang on, but they are looking into it and we will have information grounded on science.
Okay. Great.
Right. For example, we're all internists and we all probably take care of kids 16 and up. We don't go much lower as internal medicine doctors. But if you have a 16-year-old kid in your household who has asthma or who has type 1 diabetes, or juvenile arthritis, they would qualify based on their pre-existing condition and their age for the Pfizer vaccine. But again, talk to your child's doctor. As 16-year-old asthmatics are considered a little bit more higher risk. Asthma is a pre-existing condition. So if they're 16 with asthma, 16 with, something else, that's a perfect discussion to bring up with your child's pediatrician, family doctor, family physician, or internist.
Okay. Okay, great. The next question that I have, we know that there's a long list of people waiting to get the vaccine. Everyone is calling and they're not able to schedule appointments. Is it possible for anyone who wants the vaccine to call and be put on a list and just be waited out until new vaccines do come? Is that something that we're thinking about doing, or are we just scheduling people based on the amount of vaccines that we currently have?
So I can say one thing from the New York City Health Department perspective. We are, I think I mentioned the 33 kind of high priority neighborhoods or zip codes where we have higher risk populations. We are working very closely with community-based organizations and service organizations to identify their higher risk and eligible clients or patients that we are starting to develop dedicated appointment slots for, dedicated days or centers where they can get vaccinated. And so that's something that we are, it's a great question, a great suggestion. So that's something that we are working on. Unfortunately, you can't have, you can only do so much of a wait list, but we're really trying to do targeted, thoughtful outreach and access in unique ways beyond just, the refresh button over and over again.
Mm-hmm. Okay. So there are a lot of locations that are popping up. And I know that the state and the city are working on identifying different locations to help to administer the vaccines. Is there any particular protocol on the clinical standards for the locations in which these vaccines are being administered? And if so, who is monitoring that?
So I can say that there is, certainly a very clear set of recommendations and I guess, standards, I guess you could say, best practices that are put forth by the CDC. So, that's really in terms of protocols, infection control and safety for patients. And so that's something that we adhere to very much at all of our clinics, and any healthcare provider, is beholden to, their licensing, organization or to the state regulatory entities to ensure that those standards are being met.
Yeah, and I would just add that, kind of the algorithms and the protocols specifically for handling the vaccines are tightly controlled and monitored. And in fact, New York State has done a really wonderful job of actually going out and visiting the vaccine sites. I know that at New York City Health and Hospitals. Even though we're based in hospitals, we still have unannounced visits by folks from the New York State Department of Health as well as local to make sure that we are adhering. And so this is something that I have to say we're very fortunate in the state of New York to have such a very strong Department of Health that is monitoring and more importantly helping us make sure we get these vaccines into people's arms safely. So we're very lucky here in New York.
Yes, and every one of the New York City vaccination hubs has an assigned safety officer on site at all times as well. So
Great. So some of the communities, when we're talking about seniors in particular, have a little concern or fear of using computers, or either they don't have access to one. So a lot of the communication that has been distributed has been done electronically. I know that there was a mailer that had gone out about the vaccine and why you should get it, and gives you a couple of the facts regarding that. But with regard to identifying where you should go to get the vaccine, is there any type of mailer that can go out? Is there any consideration for those who do not have access to computers?
So I can say from the health department perspective, we have partnered with Dept, Department for the Aging, and they have a great list and outreach network to reach older adults. And so we're doing anything from continuing canvassing, door knocking, robocalls, senior focus calls, working with senior centers, et cetera, to get the message out to older New Yorkers as best we can.
Yeah, and I would add to that, that in addition to our great health department that is doing, a yeoman's job in getting this information out and literally having people on the ground handing out, knocking on doors, a lot of the health systems here in New York City as well are doing, including New York City Health and Hospitals, outreach to our patients. And in fact, starting with our older populations that get their care at the public hospital system, we are either sending them messages by computer, if that's what they prefer, but to your point, many don't. And so we're actually literally making phone calls to those individuals, as well as sending mailings in the snail mail. So I think it's really using multiple modalities to reach people in the way they want to receive information is going to be really critical to our success.
Okay. So I have one last question that one of our constituents had inquired about. With the long wait that we have, and I'm not sure if this would even be the best method, but our doctors, all of the doctors who would be eligible to inoculate a patient, will they have access to the vaccine? So when when their patient is coming to visit them for a regular office visit, they will be able to give them the vaccine? And the reason why I say I'm not sure if that's the best method is because we're going to see an uptick immediately on the number of people who want to get their annual physicals or get checked out. They have a cold or something like that, and that would be the reason for them to go and get their vaccine. But what are your thoughts on that?
So I can say from the distribution kind of system, the phase distribution that we're talking about through the states, I think we've gotten to now the federally qualified health centers have received vaccines so they can vaccinate their regular patients. And really our goal is, as soon as we have a stabilized supply, then we are really aiming to get vaccines available to the smaller independent practices that are primary care providers to, throughout the city. That's our goal, because we know that people want to have that discussion and relationship and with their own doctor, to give them this vaccine and to be able to talk to them about it if they have questions. And those are the most trusted sources of health information we have. So we realize it's extremely important and want to prioritize that. And if my colleagues have other things to say about that.
Yeah, just to add to Dr. Foote, remember President-elect, President Biden rather, and Vice President Harris announced last week that pharmacies would get 1 million doses, I believe, starting sometime in the next 10 to 15 days. And that will ramp up over the late winter and early spring too. So my hope and my hunch is that by midsummer, by maybe July 1st to Labor Day, it'll be quite easy to get a vaccine. And the shortage that we're having now is very short term. Our problem in about 10 to 12 days, as Dr. Foote and Dr. Wallach will tell you, is we got more than enough vaccine. We just don't have enough people to put vaccine into people's arms and sites. And that's the problem we're going to have to manage, over the next couple months, is getting places to give the shot. So yeah, we're in a short-term kind of, divot here, if you will, but that's only very, very transitory. Our biggest problem in about a month is going to be, we have so much vaccine, we don't have enough places to give it out. And that's where we need to take advantage of all of these sites here.
Yeah, and I completely agree with my colleagues, and just again want to emphasize to folks who are listening at home, that some of these logistical handling challenges that we have with the mRNA vaccines are very real, right? This ultra cold freezing and then thawing and getting them prepared, and they're only good for a few hours once you've drawn them out of the tube. So again, to Dr. Riley's point earlier on, as other products like the Johnson & Johnson product make it to market, it's a single dose. It is much more stable at room temperatures compared to some of these other vaccines. I think that what you're going to start to see is that we'll have additional options, right? So we'll be able to use certain vaccines more readily in a doctor's office. My guess is we'll still continue to have mass vaccination hubs to some extent, or distribution areas. And I think we're just going to see different ways of getting vaccine into people's arms. And again, most importantly, we want those individuals who are coming for vaccine to feel comfortable in that process, right? And if that comfort level is most there with their primary care provider or their place of care, then we want to make sure that they can get those vaccines there. If others don't mind and they want to go to a place like Yankee or Shea Stadium, awesomeness, right? And we're happy to give them their vaccine there. So we want to meet the needs of our population here in New York City and making sure they're comfortable and confident of getting that vaccine at the location that they choose. So see all the above.
Okay. Well, thank you all so very much. We have gone over an additional 10 minutes, but this was great. It was a very robust conversation. And I hope that our constituents and our viewers, everyone who's listening in, was able to get their questions answered, and that you have enough information to make your determination as to whether or not you will get this vaccine. Dr. Riley from SUNY Downstate, Dr. Foote, Mary Foote from Department of Health and Mental Hygiene, Dr. Andrew Wallach from Health and Hospitals. Thank you so much. Thank you for your time. Thank you for staying over. We appreciate all of the knowledge that you have brought to us this evening. And we look
Thank you very much. Honored to participate.
Immunity very soon.
Thank you for having us.
Thank you, Doc.
Thank you.
It was a pleasure.
Good night, everybody. Be safe.